is the career outlook for healthcare professionals sort of broadened, increased?
Interesting.
Yeah, as what little I understand of it, probably not, because it's not necessarily true that because more people will be able to afford health insurance, that more people will be seeking health care. Most of the people that can't afford insurance now, if they really need the health care, they go. They go to the emergency room, and the rest of us end up absorbing the cost through increases in premiums systemically.
Right.
Sure.
Will people go seek out a doctor more frequently if they have health coverage? Probably.
Yeah.
You'll probably see more preventative, more annual checkup stuff, which should catch things earlier and should allow treatments to be shorter and less expensive, because you're not going in after your arm's fallen off
Right.
to have something
Right.
looked at, which when you're uninsured tends to be the way you address
Yes.
health care. But they still end up going in.
Right, and that gets to a point that I've heard made accurately before. We pay for it one way or another.
Yeah. Now there are some fees and some taxes and some tax breaks in this healthcare act, and some folks are saying that there are some doctors' offices that may end up closing because in a lot of cases small offices have such thin profit margins to begin with that even if in the long run they could make money off of it, they're not going to necessarily be able to survive the short-term changes.
That's unfortunate.
And that's unfortunate.
Yeah. It's the whole healthcare thing is for me anyway. It's scary.
Yeah.
It's one of those things, and yeah, I would very much like to have health insurance. I currently don't have health insurance because I simply, I lost my job. I couldn't, I kept my COBRA as long as I could, but I couldn't afford it. And
that was COBRA with the 60% paid by the government.
That was with that was even with with the subsidy.
Yeah, with
I was
the
able to carry
unemployment
it
COBRA
for a
subsidy.
while, but without the subsidy, I would have lost it almost immediately.
Yeah.
And that's scary. I certainly have health concerns, and especially being trans. I have maintenance requirements, hormonal maintenance requirements and stuff that are very difficult because of that. And so the whole healthcare thing is very kind of scary for me.
Well, and even there's I have a friend whose daughter has some serious emotional problems, some of the less friendly side effects of Asperger's, and she's on medication that keeps her level, and she's just now graduating from her bachelor's program, and they're looking at getting her into a master's degree program. But the medication's $80 per pill.
Ouch. Yes.
Wow. And that's a lot of pills and a lot of money every month and every year. And he says, I have to pay the cost of COBRA because I can't afford I can't afford not to. I can't afford the medication any other way.
Yeah.
And without getting into all the finer points of why the pill costs $80 per pill.
Sure.
Yeah,
that's a whole different thing.
That's a whole different thing.
Argument.
Which, again, this is a Health Insurance Reform Act. This isn't a Health Care Reform Act. We're not seriously addressing changing the way we distribute health care. Many of the options, paying flat fees for services instead of paying per visit, that kind of thing, were tossed out fairly early. And it's basically turned into health insurance reform. How to cover more people, how to make health insurance more accessible, how to make private health insurance more accessible.
By the way, for those who don't know, Asperger's is high-functioning autism. Something that we certainly know a little bit about. But anyway, Yeah, the whole thing is kind of scary, and I don't want to belabor the healthcare thing. I'm hoping this is all going to work out and sort of eventually work well.
Well, people are really fond of the Medicare and Medicaid programs, especially the people who are benefiting from them. And what folks have to remember is that Medicare and Medicaid, as they exist today, were not the bills that were passed.
Sure.
As they were implemented and problems were found, modifications were made, things were streamlined, things were improved. You'll see, I expect the same thing will happen with this as time goes on. We'll find the spots where efficiencies work well, and we'll hopefully be able to change the things that don't work so well, provided we can stop throwing water balloons at each other in Washington and actually have conversations about issues.
Yeah.
But
it's really kind of, a lot of it's really kind of childish, isn't it? But hey, I'm not quite ready to run for public office. So I'll have to leave them to do their thing, I guess. And hopefully this will all play out, and in 2013, 2018,
it's a little ways off.
that's a little ways off, and hopefully the world won't end in 2012.
It makes it all moot.
It's all crazy. Tara and I were watching a thing last night on Nostradamus.
And he predicts 2012, just like the Mayan calendar.
Yeah, and the Mayan calendar ends. It's all very interesting.
Even his recently discovered book tells you how and when the world will end. But
yeah, it's all.
It's interesting.
It is. It's fascinating stuff. I don't know if I buy into any of it, but it's fascinating. So.
One interesting thing about the healthcare debate in America, regardless of the rhetoric going on from Washington.
And regardless of the world ending.
Regardless of the world ending. One of the things that's been talked about a lot is how Americans hate this bill. And we've progressively watched support for the healthcare bill fall down into the roughly mid-30s. The day after the healthcare bill passed, there were some more polls taken. One poll put support for the healthcare bill up into about 42%, and another one put support for the healthcare bill up around 47-49%.
It's interesting.
So the question in my head, as you had said, sort of follow on, is did they really dislike the healthcare bill itself, or did they really dislike the stagnation and bickering around the healthcare bill?
Yes. That's yeah, exactly.
Was the healthcare bill, sort of the albatross that was a really good thing until somebody screwed it up?
Yeah, it's really unfortunate. I mean, we've kind of been down this road before.
Yeah.
And it's a mess, and it's too bad, because I really, personally, I think we need it. I think we need,
It's been almost 100 years that our country's been trying to decide whether or not health care is the right of every American citizen or not. And up until this past weekend, we couldn't decide. We were the only first world nation in the world that couldn't decide if access to health care was a fundamental right of being a citizen of the country.
Sure.
Right.
Yeah.
And being a citizen of the richest country in the world.
Yeah, it really is kind of ridiculous, and yeah, I can tell you from firsthand experience, it's not having health insurance is scary. And I wonder. I know you're saying 95%, and I wonder about that other 5%. What happens to the homeless people?
Right.
I mean, obviously, if you're homeless, you can access some degree of health care, but
well, and the 95% is health insurance. 95% of the country should be able to afford health insurance due to this plan. The other 5% are going to end up using emergency services the same as they are now.
Yeah, which
works. As you said, may be more expensive in the long run and may be too late.
Right, for the individual problems.
Yeah.
It should reduce the, I don't want to say invisible, but the indirect burden of cost.
Right.
Getting more people insured should reduce the indirect cost.
Yeah, certainly the accessing health care by going to the emergency room is difficult and expensive for